All right. So today we have Dr. Heather Wobbe present from University Hospitals. Heather Wobbe, DO, MBA, and FAPA, is a combat veteran with service in Iraq and Afghanistan. She completed her psychiatry residency training at University Hospitals, Cleveland Medical Center, with concurrent completion of the Leadership and Medical Education track and the Public and Community Psychiatry Fellowship. She then joined the faculty of UH Department of Psychiatry and the Case Western Reserve University School of Medicine, where she provided a broad range of psychiatric services to adults in need and served as the co-director of the Public and Community Psychiatry Fellowship. Dr. Wobbe then transitioned over to Summa Health, where she served as their first director of emergency psychiatry and developed a new service line for the health system. She returned to University Hospitals Cleveland Medical Center, serving as the medical director of the Emergency Psychiatry Access Team and director of the Case Western Reserve University/University Hospitals Cleveland Medical Center's Public and Community Psychiatry Fellowship. Her professional interests include improving access to affordable, high-quality mental health care, particularly for those people in crisis, and promoting health equity through evidence-based lifestyle interventions. She has presented locally, nationally, and internationally on these topics. Within her local community, Dr. Wobbe has served in leadership roles within the Cleveland Psychiatric Society, the Ohio Psychiatric Physicians Association, the OPPA, and the Ohio Psychiatric Physicians Foundation, which is the charitable arm of the OPPA. Dr. Wobbe, we are so grateful for your expertise and your presentation today. I'll let you go ahead and get started.
Thanks so much for the kind introduction, Peyton. And just, in full disclosure, I'm working clinically today. So if our overhead page goes off in the hospital, I might pause because they're going to say whatever they're going to say 3 times, and it's really hard to talk over it, right? Peyton asked me to speak today on kind of the connection between physical health and mental health and what this means for our clients and, really for our community, which is a topic near and dear to my heart. Let me see. All righty. So kind of diving in, we're going to be talking about comparing and contrasting the various definitions of health, reflecting on the complicated relationship between mental and physical well-being and health, and then understanding some specific recommendations on lifestyle changes that improve both physical and mental well-being. I don't have any financial conflicts of interest. However, I do have a disclaimer. I am a physician. However, I don't think I'm anyone on this call's physician. So please don't construe anything I say as like particular medical advice, okay? Alrighty, so what does it mean to be healthy, kind of as a starting point? So there is some thought, and this is particular, I think, oftentimes in the medical community, that health is the absence of disease. But that is not what the World Health Organization, even since 1948, has defined health as. So health, as defined by the World Health Organization, is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And there is some kind of angst around the word complete. Like complete is a very high bar, right? And so that portion, there's some, kind of conflict in the field about, well, then is anybody ever healthy? Because that is a really high bar. But that is, kind of how they define it. How I think about it is it's really, kind of a coming together of body, mind, and spirit to help people live the best quality of life that they're able to. So I agree, not just merely the absence of disease or infirmity, but actually well-being. So what I think of when I think of health is really a combination of genetics, so kind of what you're born with, sort of affects your predisposition to certain diseases or your resilience against certain health concerns. And then the choices that you make, And then unfortunately, there's this component that's a sort of like luck, like how actually lucky are you in your life? And that they all kind of come together and determine a certain level of health that you're going to experience. And so really, when you think about this equation, we don't control our genetics. They are, sort of what we're born with. Luck, by definition, we're sort of, it just is or it isn't. But the choices piece, that we can really affect. So I think that in my practice, that's where I really try to spend a lot of my focus. So thinking about how physical and mental health are interconnected. So, you have a certain state, if you think about it, um, you have a certain state of physical well-being today, each one of us does, and we have a certain state of mental well-being today. And then we have some mediators. And so those mediators might include some lifestyle variables and some socioeconomic factors, kind of the big buckets. And as a result, we're going to get some different level of health, both physically and mentally, later on down the road. So we kind of see those physical and mental factors playing through these mediators into future health status. We also can see those physical and mental health now can just progress. So even if those mediators are absolutely, optimized, they're perfect, they're as good as we could imagine, some diseases just will progress over time. So that's important to keep in mind as well. And so when I think about the relationship within any one of those boxes, when you're thinking about how physical and mental health are interconnected, what I think of is when you sometimes see things that have the same cause, right? So that's a common physiologic pathway of disease. And that, for example, might be trisomy 21, or what we know as Down syndrome, is related to Alzheimer's disease. And that is on a pathway, it's actually sitting on the same gene. And so if you have, um, a certain type of genetic presentation, you have an increased risk for Alzheimer's and you have trisomy 21. And those two things are connected very, very biologically, very genetically. You can have, one thing causing another. So, for example, if you have someone that has chronic physical pain, that can lead to, some level of mental distress, oftentimes depression or anxiety. And those symptoms of one disease are really leading to symptoms of another. And vice versa, right? So if you have, for example, significant mental, health problems such as maybe depression, you're maybe isolating, spending more time in bed than you normally would, and as a result, you might develop back pain or that sort of thing because you're less active and moving than you might otherwise be. So that's, kind of how a different pathway might occur that kind of links the two. And then we have to think about when the treatment of one might cause the other. And that's something as, someone who prescribes a lot of psychotropic medications, I think about a lot, right? So when one illness gets treatment and then that treatment causes another illness. And for example, that might be, a patient that I might see for schizophrenia, and I might prescribe a second-gen antipsychotic that has a side effect of weight gain. And that person's maybe on that antipsychotic for a long period of time and develops a metabolic syndrome, gains some weight, has maybe complications from obesity, like, joint pain and that sort of thing. And that's really, start where you start seeing things interconnected. So, there's a bunch of different ways that they can be linked. And also you can sometimes have two, two types of disorders that are linked in multiple different kinds of ways. So it's really, really complicated, unfortunately, to untangle. There's no kind of one right answer here. And so there is some ongoing tension in mental health treatment. And I just want to kind of put this out there. There has been a lot of back and forth in the mental health field across decades, that kind of is looking at, is the mind separate from the body, so there's like kind of that first division. And then is something biological or is it psychological? And I think, many professionals kind of go back and forth on this a great deal, but thinking about how those two concepts are interconnected, I think can be really, really powerful. And sometimes it may lead us to make a choice that we wouldn't otherwise make. So if the field of, I'm a psychiatrist. If the field of psychiatry didn't exist, I might have more training in hormones than I did, throughout my actual training. And I might view things very differently. I might view things through a lens of maybe an endocrinologist or a neurologist, but we've kind of made this schism. And so some of that is inherent just in our medical system in the way that we're all trained. And so the thing that strikes me is that we have this tension between biological and psychological, but we don't really talk a lot about where physical health fits in oftentimes. So we're going to be kind of talking about that a little bit now. We also don't talk about these mediators. So those are those lifestyle and socioeconomic factors at play. A lot of times we sort of view people as, the tendency is a snapshot in time. We see a symptom, we prescribe a medication, we see some level of distress, we address that through therapy, but we don't necessarily look at what's happening when the person's not in front of us as much as we might in other cases. So we're going to be spending a lot of time talking about those two concepts. So thinking first more about mediators. So when you're thinking about lifestyle variables, I kind of revert back to the 6 pillars of lifestyle medicine. And part of that is because I do that because it's really the best evidence that we have for evidence-based treatment of disease, both physical and mental, through lifestyle changes. So if I can kind of clump things in my head into these 6 pillars, and we're going to kind of go through them a little in greater detail in upcoming slides. If I can kind of group them into my head, well, then I can say, well, how much does this apply to the person that I'm seeing in my office? And where, through shared decision making, where is the best place to approach maybe a lifestyle change? And what I found is if I'm looking at the lifestyle variables of my patients who struggle with mental health, they look very much like the lifestyle variables and factors that my colleagues who are in primary care see. There's a lot of consistency between mental health and physical health when it comes to these lifestyle choices. I also want to call out that there are a lot of socioeconomic factors at play, and these can relate to jobs and income, retirement. It can expand to where you live and how safe your built environment is, um, your educational opportunities, your sense of felt safety in your community. All of these things play a role, and they are not necessarily up to an individual's choice, right? I don't know that anybody would choose to live in abject poverty if they had a choice to do something different. And unfortunately, for many of the folks that we see, the socioeconomic factors are playing a huge role, and they may not be able to be modified readily by the individual. That may require more of a community or societal approach. So I just kind of want to throw that out there. That even if you have a client and that client is like doing everything right as far as their lifestyle variables, socioeconomic factors still play a huge role. Alrighty, so talking about the 6 pillars, and we're going to spend a bit of time here. As I mentioned, these are very consistent across both physical and mental health. These are evidence-based. So there's a lot of kind of stuff out there. I have a lot of the patients that I see that talk to me about like, oh, I saw this on TikTok, or I Googled that, or Reddit said this. And I'm not going to be talking much about those today because they're of varying degrees of accuracy and science. So these are all specifically things that have a strong foundation in scientific research. And I would also say that these are things that don't tend to have a lot of side effects. There's a couple exceptions, and I'm going to try to call those out as we kind of go. But for the most part, these are things that are just kind of compatible with overall health and have really good sets of evidence for both improving physical and mental well-being. So the first is whole food, plant-based nutrition. We're going to talk about that in some detail. The second is physical activity. The third is stress management. The fourth is avoidance of risky substances. Then we have restorative sleep and social connection. And so we're going to kind of dive into each one a little bit. So the first one is whole food plant-based nutrition. And, there's a lot of information out there about what people should be eating. And I use should in kind of my air quotes. There's a lot of diet advice, eat this, don't eat that, intermittent fasting, eat during these times, eat 4 to 6 small meals a day, eat one large meal a day. A lot of them are contradictory and it's really can be very confusing. I know, as a person who's trying to be healthy, I struggle with this too. There's a lot of information, misinformation, or kind of information that's really like taken out of context out there. So the best data that we have, and this is recommended by the American College for Lifestyle Medicine, and generally is accepted by most practitioners, is focusing on a diet that is high in fruits, vegetables, legumes. So that's your like beans and lentils, beans and pulses, nuts, seeds, and whole grains, and kind of reducing, if at all possible, sugary drinks, the amount of meat that you're eating, processed foods, dairy, and eggs. And so, these kind of concepts for most people are going to be conducive to like a fairly healthy body, right? A fairly healthy diet. There are some exceptions with specific medical conditions where somebody might not be able to eat certain things or might be required to eat other things, to kind of to make up dietary deficiencies. So I would kind of take this with a grain of salt if someone has a lot of like, kind of complex medical conditions. But in general, if you think about, sort of like the good old food pyramid, this kind of lines up with that. Um, what I would caveat this with, and this is when I'm talking with patients about nutrition recommendations, is this is not a vegan diet, right? It is heavily plant-based, but it is not vegan. And it's not vegan for two very key reasons. One is it's not saying like, oh my gosh, I'm never going to eat meat. I'm never going to eat dairy. I'm going to give up all of these things completely, right? So it's not as restrictive. And the other thing is, if you weren't aware, Oreo cookies are vegan. And they are not something that, as a doctor, I would recommend that everybody eat a huge amount of, right? They're not considered a healthy food. So just because something is vegan does not mean that it's healthy for you. And I think that there's a lot of kind of like food advertising noise out there that can be really, really confusing to a lot of folks. And so sometimes people will kind of use the term vegan as like a shortcut. And I really don't think that that's a good idea. So I really think kind of relying on the definitions of increasing the fruits, vegetables, legumes, nuts, seeds, and whole grains as you're able to, and minimizing the sugary drinks, meats, processed foods, dairies, and eggs as much as possible is a better way to go than just saying like eat a vegan diet or eat a vegetarian diet. Some good resources are eatright.org is a great website. There's also food at fullplateliving.org, another great website. And if you go on the College of Lifestyle Medicine, so that's lifestylemedicine.org, it's cited in the bottom left corner. They do have, I think you have to sign up for it, but they have for lay folks, they do have a food as medicine jumpstart guide. And I will just tell you, personally, my husband and I were trying to make some healthy eating choices, improvements in our home. And he's very much a meat and potatoes kind of person. And he also does all the cooking. So I needed him to be on board with this. And so I downloaded this and he was like a little bit skeptical, like, oh, I like my meat, I like my eggs, I like my food. And really found some really helpful recipes in the Food as Medicine Jumpstart Guide. It's like pretty accessible for folks that have typically eaten a standard American diet. and are trying to like incorporate more whole food, plant-based nutrition in their lives. So I would highly recommend that. The other thing I try to think about when I'm working with patients about making some of these lifestyle choices is that what you're looking for is really progress and not perfection. So are you doing anything totally wrong if all of a sudden you're out and grandma comes with a piece of pie and it's so good and like she really wants you to have her pie? No, you should eat the pie because, it'll make grandma happy, it'll make you happy, and it's a piece of pie. It's not the end of the universe. So, kind of thinking about where you can make some smart substitutes, I think can be really, really helpful. And so, a lot of times when I'm working with my patients on this, I'll be thinking about, like, well, what is their routine and where can they make a substitution that's relatively simple, right? So, oftentimes, people maybe don't eat breakfast and then they get to work and then maybe there's like a lot of donuts in the snack room and then they're kind of hungry and then they have a donut and then they're like, well, I already had a donut today, so now I can just, have pizza for lunch and then it's kind of like off track for the day. And so, oftentimes I'll find if people like are able to substitute in maybe some oatmeal with some fresh fruit in the morning, then, their day kind of starts off right and they don't really notice the substitution that much. It's still pretty in line with the rest of their day. That small choice really sets them up for a major success. So you kind of want to be thinking about what will work for people. I work a lot of hours. If you ask me to come home and like, make this whole big fancy meal every night, it's not going to happen. So we got to think about like what works with life, right? So that's kind of the whole food plant-based nutrition. That's one key area. And I would say if people are open to making changes here, I do think that people will see a lot of benefits really across all of the lifestyle factors across their physical and mental health. I think they'll see a lot of improvement if they're open to it. Before I move on, I do want to mention at no point did you hear me say anything about caloric intake. And that's very deliberate, right? Because if you're making all of these changes, then trying to restrict like portion sizes or trying to log your calories or that sort of thing can be really overwhelming. It's a lot to keep up with. So what I would say is, if a client is open to making choices around here, I would think about adding in fruits, vegetables, legumes, nuts, seeds, and whole grains before I think about restricting things. And I would also think about making substitutions that make sense, right? So if I'm having, like a fruit juice drink, could I just eat a piece of fruit instead? And then I'm getting fiber and I'm maybe reducing any added sugar, that sort of thing. So you want to make sure that it's like working with the person and their lifestyle and that you're adding in rather than taking away and not making it so burdensome, because it can be really overwhelming. And if you told me that I could never eat cheese ever again in my life, I think I would, probably cry a little bit. I'm a big cheese fan, so got to accept some things where people are. So talking now about physical activity. So this is kind of the second pillar that I would be thinking about if people are open to it. And again, there are some weekly activity goals, and these are, for a 7-day period, 150 to 300 minutes of moderate intensity activity, or 75 minutes to 150 minutes per week of vigorous activity. So moderate activity is like, you can feel yourself kind of working. You might feel like a little bit out of breath, but you're still able to carry on a conversation. Vigorous activity is going to be when you can only talk in like maybe 2 words at a time and you're like actively breathing hard. And in addition to the cardio activity, it's recommended to do 2 days of strength training, and that's really to keep muscle mass. This is especially important as people age because we all tend to lose muscle mass over time, and muscle mass is what is most metabolically active. So that's how you keep from gaining weight, is if you have more muscle, then you're able to eat food and use it appropriately rather than having it be stored as fat. It also helps with bone strength and, the ability to kind of like keep your balance, which as we age, we're at a higher risk maybe for falls. And so those kinds of things can be really important. With this, I want to emphasize that this is like not all at once. And so when you're talking with clients about making a change regarding physical activity, I would say looking at where people start and kind of having a plan to incrementally just increase it a little bit it is fine, right? Like you don't have to go from like sitting on your couch all day long to 300 minutes of walking per week. That might not be reasonable, but I think if you can kind of take those little incremental steps, that can really pay off. What I would say is because it doesn't all have to be at once, sometimes thinking about how people live their lives and ways to work in physical activity into that can be really important. So if, for example, somebody, talks on their cell phone to their family member every day for an hour, could they do that while walking? I mean, because if they could, they're exceeding this requirement already. Or could they every other day or maybe one time a week take that phone on a walk? Um, Also, if, somebody is, kind of running their normal errands, maybe they park at the end of the parking lot, maybe they take a set of stairs instead of an escalator or elevator. Those kinds of small changes really make a huge difference. So again, emphasizing progress and not perfection. And emphasizing things that are enjoyable, right? So it doesn't really matter what these exercises, this physical activity is. It just matters that you do it and that you do it consistently over time. And I'll just say I'm more likely, as a human, to consistently do something I enjoy over time than to consistently do something I intensely dislike. So thinking about like, does it make sense to take a dance class, or does it make sense to, take up a hobby that maybe you were doing in your house, but maybe you could take it outside and maybe have that, kind of take up some of these minutes of physical activity that we're working towards. There's some free resources. One is a health.gov website. They have a Move Your Way page that can be helpful, sort of for brainstorming some options. There's an acefitness.org. The VA has a free app, Move Coach, and that can be helpful for folks kind of getting started with how to really make this a part of their life. All righty. So now kind of talking a little bit about stress management. And really what's recommended is mindfulness-based stress reduction. I'm going to say that it needs to work for the individual, right? So I have a lot of folks who are like, oh yeah, I don't do meditation. I'm not a mindfulness person. And what I would say is kind of exploring different ways that mindfulness might occur in day-to-day life can be really helpful. Like I will just say I am not a yoga person. And so if I have to sit through a yoga class, personally for me, it ends up making me more stressed at the end because I'm very like angsty the whole time. So I'm kind of on edge. And then at the end, I'm feeling like vaguely dissatisfied. And it's just I walk out more stressed than I walked in. So that's not good. So I need to take yoga off my table and say like this is not going to be something that works for me. Versus, for me, I'm an outdoor person. So if I go for a walk outside and I have some like relaxing music on and I'm just kind of letting my mind go where it goes and being present in the moment, my stress levels will go down. So really this is like an opportunity for everyone to sort of explore, where they find their peace and how they can incorporate that into their lives. There's some resources. One is about what mindfulness-based stress reduction is. That's a mindfulleader.org. I will say that they have a lot of links to different courses there, and those courses are not inexpensive. So I am not endorsing them because I think free is the best way to go for a lot of folks. But they are a resource if that is something that somebody would want to invest in. There's a couple free apps. Some of them have like little paid add-ons, but they usually have a free component to them. So one is the Headspace app that has both sleep and meditation, the Calm app, a mindfulness coach. So those might be options for folks, but really kind of being able to recognize stress and take it down a notch. And, kind of before we move on, I do want to say something about chronic versus like acute stress. So I think we all are pretty okay, or oftentimes pretty okay at recognizing an acute increase in stress, right? So when I get, uh, text from my boss that says I need to speak with you right away, and I can feel my stress levels go up. I know that I'm more stressed than I was before. I think where we kind of collectively struggle a little bit more and have a tendency to have difficulty identifying our stress is when it's really chronic. So when you have somebody who's chronically overstretched in their lives, chronically trying to juggle 50,000 balls and not let anything drop, those kinds of things. It's a little bit harder to pick up on sometimes. So a lot of times I'll find that my patients will say, no, 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 I'm not stressed. And then when you talk to them about everything they're doing, you're like, oh my gosh, I think you really are stressed. But because it's been so long duration for them and so consistent, it's hard to sort of recognize. So I think sort of picking that apart is an important first step for a lot of folks to say, like, yes, indeed, like I am living with a high level of stress and I can accept that, but now maybe is that something that I'm willing to work on right now? Alrighty, so thinking about then avoidance of risky substances, um, there have been studies that have shown that alcohol in moderation, any amount of alcohol, increases risk of at least 7 types of cancer. So there are some recommendations out there to avoid alcohol completely. I know there's been a lot of back and forth over the years about like, is red wine healthy and, et cetera, et cetera, et cetera. And I do think that the evidence is kind of coming out that shows that really alcohol, even in moderation, is not something that should be pursued as a healthy choice. That being said, it's something that a lot of people tend to partake in. The current guidelines are less than 2 drinks per day for men, and less than or equal to 2 drinks per day for men, and less than or equal to 1 drink per day for women. I will say that these need to be standard drinks. So thinking about what constitutes a standard drink is not a giant glass of wine that's filled to the brim. That is not a standard drink. That is at least probably 2 standard drinks. So, kind of keeping in touch with what a standard drink is, because that's what these guidelines are based on. I will say that, avoidance of risky substances also applies to things like nicotine. That is both smoking, vaping, chew, dip, whatever. Also, I would say cannabis, I know it's recreational in Ohio now. Um, I have yet to hear it linked with like improved health. So I would definitely exercise some caution about that, especially if it's in smoked form, because then you're also taking that into your lungs. And then obviously, the more recreational drugs, heroin, cocaine, et cetera, methamphetamines, would not be something that would be recommended. I have put a bunch of different resources for folks that want to make a change in this area. These are all, again, free, and they really have a bunch of different approaches. So sometimes I'll see folks that are like, I'm not really like an AA person, but I want to make a change in my drinking, and they find smart recovery to be helpful. So there are a bunch of different options for things that hopefully people will find one that fits their needs. While we're on the topic of risky substances, I will talk about certain things, so when you think about what happened up in Flint, Michigan with lead contamination in the drinking water, that sort of thing. What I would say is people who are exposed to environmental risks, either from where they live or where, what kind of job they do, that sort of thing, I would definitely work with the folks in their local community to help try to address those things. So there are resources in the community if you're exposed to, say, like lead paint, that sort of thing. They do have resources for like lead abatement. And if there's an occupational hazard, then employers should be providing personal protective equipment to help address those risks. So avoidance of risky substances is not just like drugs and alcohol and tobacco. It also is, kind of everything that can enter our bodies, right? If it's harmful. Okay. So then thinking about restorative sleep, and I'm going to say this is another place where I see people make great strides. Typically, the goal is 7 to 9 hours of sleep. in every 24 hours. I think I give my talk about getting good quality sleep very, very frequently. But really the focus there is minimizing sleep disruptors. So thinking about, not being on your phone all night, from your bed, like, with that bright light, not watching TV in bed, maybe not eating or drinking in excess right before bedtime, because that can affect your sleep. And one of the things I do find is that for a lot of my patients, especially those struggling with mental health, they tend to spend a lot of time in bed. And they're not really sleeping that whole time. They're just sort of in bed. And that can really confuse your body and its circadian rhythm and really lead to sort of this like poor quality sleep that's not restorative. Um, so I would be thinking about kind of those basic, you know, sleep hygiene kinds of things that we can talk to our clients about. And certainly keeping an eye open for effects of medications on sleep, be it good or bad, whether they're making the person too sleepy or they're keeping them awake at night. That's something that they can talk with the individual who prescribed those medications and maybe come up with a better solution. I also have seen a lot of untreated and undiagnosed sleep apnea, so obstructive sleep apnea. And that can present as, the person is getting sleep, but when they wake up, they're not restored. They're not restored. It's very, they're still exhausted. They might have a morning headache. They just never feel good. They might have some foggy thinking. And so again, that's things that I would recommend people, speak with their primary care physician, primary care provider about to try to optimize. If there's more, kind of sleep habits. There are some free resources. So there's some apps, Insomnia Coach or CBTI, which is cognitive behavioral therapy for insomnia. There's a CBTI Coach app, and those are both free. And then there's also an app that's pretty interesting. It's called Sleepio. And it was recently FDA approved. It's basically a form of CBTI, but it was FDA, I'm not sure FDA approved. It was approved by the governing body, I think the FDA, for help with sleep. And it does require a prescription. But again, if people are seeing their primary care provider for help with their sleep, that is certainly something that might be an option for somebody that kind of wants to pursue non-medication options, which would always be my recommendation. Alrighty, so then thinking about our social connections. So social connection, I think we all sort of discovered during COVID times that we're pretty social beings. Even the folks I knew who swore that they were the biggest introverts on the planet, at a certain point during COVID, they're like, I really would like to see another human. And so, I think we all kind of have recognized a little bit the importance of social connection. And when your physical and mental well-being is not doing well, when you're not doing well from those perspectives, I think it's really easy to kind of let yourself get isolated and kind of stay at home and become like a little turtle and you tuck up in your shell a little bit. And so one of the things I think that can help both get people back to a state of health and also help them maintain that is to work on areas of social connection. So a lot of times, I'll ask patients, well, like, how do you spend your day? And they'll describe to me when they're not doing very well that they get up late, they kind of sit down in front of YouTube, they watch some videos, they might order in some food, they kind of nap on the couch, and so you're kind of like, well, you're not actually actively participating in your own life at this point. And so if people are open to it, I think a good way to start fostering social connection, if that is a problem, would be things like volunteering, getting involved in community organizations, because you're both going to be giving back, you're going to have a little bit more structure to your day, and you're going to also meet some people and then be able to establish those connections. So I think sometimes it's a little bit hard for folks. A lot of folks who are working get that structure from their job. But if somebody is not able to work, then I think volunteering can help get them back into the swing of things, get them back to that structure. I also encourage folks, if you're looking at ways to improve social connection, can you look for opportunities that improve other areas of health? So, like it's like a 2-for-1 kind of deal. And so, thinking about, is there a group activity that you might be able to participate in? So, do you have like a meetup group that meets up and then goes for a walk in one of our metro parks? That might be an option. Or is there a place that's offering a healthy cooking class where you can learn about whole food, plant-based nutrition while also meeting other people who have similar interests, right? So kind of looking for where you can kind of tie these positive habits together. It both makes the habit a little easier to make a long-term change because you're really like tying two positive things together. And it also helps, I think, with like the argument that I hear a lot, which is like, I don't have time for all of this, right? So if you're getting this like 2-for-1 or 3-for-1 benefit, then all of a sudden, well, like I guess if you can have time to do one healthy thing, you have actually just accomplished three or two or whatever it is. So I think that could be pretty helpful for some folks. There are some resources. I would cautiously use meetup.com. There's also a site purposebuiltfamilies.com if folks are really struggling to kind of make some connections. And also like local community resources, I think can be really helpful. And so what I would say is there's a couple places to get more information. I've referenced a bunch of things from lifestylemedicine.org, and they have a lot of great patient resources. So that's the website on the right. And if they go to where it says in the right corner, it's kind of hard to see, like I am a, and it has a whole bunch of different options for people that are interested in pursuing board certification in lifestyle medicine versus people who are clinicians who just want to kind of like get some resources for their clients versus our patients, so just really accessible, evidence-based resources for folks that I think helps to kind of get off the crazy TikTok, hamster wheel of like, this is the newest, latest, and greatest fad. These things are actually evidence-based and vetted by experienced and seasoned clinicians. And then the other, I would just put a plug in for psychiatry.org. So that's the APA website. And 2025 has been a big lifestyle medicine type year for the APA. They're kind of really excited about it. I'm really excited about it too. And so they have launched a page that is all about lifestyle to support mental health. And I included a screenshot. It's tailored towards patients and families and kind of talks, again, you see the same 6 pillars coming back up. It kind of talks about different changes that people can make to improve mental well-being. So that's another resource for folks. And they have a bunch of different, like, kind of additional information that you can see on that website. As always, the hardest step is the first step, right? So I would say, kind of tips for getting started, thinking about assessing, and I would assess, kind of where you are, where clients, are in their journey, primary concerns, what resources are available, and likely barriers to moving ahead, so you're kind of getting an idea of the lay of the land. Some people prefer like a structured program, and those might be things that incorporate, social elements like clubs or community groups or fitness classes with friends, so that you're kind of, again, pairing these things together. I would absolutely recommend that any, patients of mine work with both their primary and mental health care clinicians to identify if there's any health professionals or specialists for specific support, right? So I am not an expert in sleep apnea, but I do know some. And so, putting in referrals as needed, maybe for sleep specialists or nutrition specialists or physical therapists, if there's, health concerns, I think those can really remove some of those barriers that folks will identify to moving forward with healthy lifestyle choices. So, if they just need some specialized support to kind of get the ball rolling, I think that's a great thing. I think clients working on their own or working with healthcare clinicians, really kind of setting those SMART goals, I think can be a huge, huge change. Because a lot of times what I find is that people, kind of jump on this bandwagon for healthy lifestyle choices and they're like, I'm going to only eat, whole foods and I'm going to be, I'm going to eat no meat, no dairy, no eggs, nothing processed. Everything's great. I'm going to work out 5 days a week for an hour each time and it's going to be amazing. And then what you find out is that they can do that for like 3 days and then something comes up and then it falls by the wayside. And so I oftentimes find it's best if I can pull back a little bit, so if somebody tells me like, okay, I think I'm super excited for these changes and I think I can work out 5 days a week. I'm like, well, how about three? And if you think you can work out for an hour, how about 20 minutes? And let's have you be successful with those goals before you kind of up the amount or the intensity or whatever, because you want people to be successful. That's the realistic part of the SMART goal, or achievable. And then you also want to consider the time it takes to form a habit. So maybe holding back on some of those changes in order to kind of really like make the initial change a part of their daily life, I think can be helpful. Because a lot of times people, sort of have this wake up call and they want to change everything at once. And that oftentimes sort of, you know, devolves to them not being able to sustain any change. So it's better to do like one thing consistently and fairly well rather than to do everything perfectly for like 5 minutes and then fall off the wagon, so to speak. I think digital tools can be really helpful. Things like apps for guided meditation, tracking fitness and nutrition if people want to. Some people like to see those like goals being met, and so they get like that kind of reward, when they meet their step count, for example, that sort of thing. So I think that those can be really helpful. I do think that kind of knowing some of those key sources is important because, I think if it's onerous for the individual, then they shouldn't be doing it. And I think if it's like not based in good science, like, things like nutrition tracking, if it's tracking a lot of calories, can be really hazardous if somebody has like a history of restricting their caloric intake, that sort of thing. It can kind of set off some of those things. So use with caution. And then, as clinicians and as consumers of healthcare services ourselves, kind of getting the conversation started. So encouraging people to talk about lifestyle changes that they can make to reduce or eliminate the need for medication or improve their overall health, depending on their goals. Thinking about treatment plans that include nutrition and physical activity and stress management, tracking progress, always good. And then what changes could you make to your environment that might better help support the health goals that the person's working towards? I think these are all good questions and good conversations to have. These are my references. And so at this point, I'm going to probably stop sharing my screen. Maybe we can stop the recording and we can take some questions.
Thank you so much, Heather.
Yeah.
Let me go ahead and stop this recording and let's check to see what questions we have.